Hi, okay, I'm Dr. Alan Greenberg, and this is the third part of different ailments. So I want to talk a little bit about back pain and neck. I think the statistics are something like 66% of the population has neck and back pain. So homeopathic medicine is based on something called the law of similar. Meaning that if you can find a substance that makes the same problem, if you give that same substance in a very diluted dose, it'll cure you. You've seen that on my other videos. Okay, it's kind of like a vaccination in a way. So how do I actually find that? So first, you describe the problem to me. For instance, I have back pain, and it's a stabbing pain, for instance. Sharp, right? It's a stabbing pain. And it happened, and also, by the way, not only do I have back pain, but an additional complaint for me is I also have problems with my bowels. I go to the restroom too much. Okay, so we have a secondary problem of diarrhea. Probably should be another R there. So we get back and neck pain. I ask you to describe it. You say it's a stabbing pain. Then I'll ask you, well, where is it? And you'll say it's in my low back. Okay? And how often do you get this? I have it daily. And how intense does it get? It can be up to a 10. It could be so bad it debilitates me. Okay? Now, the easiest way for me to get to the homeopathic diagnosis is we use something called a checklist. So this is what the checklist looks like, and this is what how it's going to be used. So you're going to go through it, and you're going to mark things that improve you and things that aggravate you. So in other words, typical back stuff, right? Some people, getting out of a chair, rising from a seat hurts. Some people, it's better if they lay down. Some people, it's better if they walk around. Okay? Like, I'll give you an example. I just had a patient that they came in with horrible congestion and allergies, and that was their main complaint, but they also had back pain. And what she told me was, the more she moves, the better she feels. But if she exerts too much, for instance, like she helps a family member sweep and mop for for the job, her back will get worse. So she's better she's worse if she sits too long in the office, better if she walks around and moves, but worse if she overexerts, okay? And then we have to find the homeopathic medicine that has those symptoms plus the congestion, which makes her sneeze and gives her sore throats, and she needs to use Afrin because she can't breathe all the time and disturbs her sleep. And this makes up the whole problem. And you'll hear me say this kind of description from problem to problem, because this is how homeopathic medicine works. It's not the particular ailment that's the problem, okay? It's the combination of all the symptoms, physical, mental, and emotional, that makes you sick, okay? And then we give you the homeopathic medicine. You take 5 drops, you put it in water, you take a teaspoon of it, you swish it around your mouth. Most people feel better within 7 to 10 days, and then usually within 3 to 6 months, they get cured. Okay, once again, I'm Dr. Alan Greenberg. Thank you very much, and see you in the next ailment.